in today's lecture, we will continue from the cyclophosphamide. Let me briefly revise about yesterday's lecture. See, in anti-cancer drugs, mainly we have these classes. These are important classes of anti-neoplastic drugs. Always you have to remember these are main classes. In this, alkylating agents is very, very important, and these are oldest compounds. And after that, we have anti-metabolites. In these, we have again many other subclasses. We'll discuss about that in upcoming lectures. We have platinum containing compounds which are having same mechanism like alkylating agents, and we have natural compounds like Vinco alkaloids. We have epipodophyllatoxins, we have taxanes, antibiotics, okay, and we have camptothecins. Enzymes, we have, there are certain enzymes. In previous class, I made one small video about enzymes that are used in hospitals, okay. Try to watch that video from the channel. So I briefly explained about different enzymes that are important in hospitals. Therapeutically, certain enzymes are used in hospital. Okay, in that L-asparaginase is very, very important. That enzyme, again, it will come in the therapy. Okay, and we have certain miscellaneous agents in antineoplastic agents. In that we have hydroxyurea and imatinib. And along with that, the last class of antineoplastic agents are hormones. We have certain hormones and hormone antagonist. We have estrogen, progesterone, and some even male androgens and anti-androgens that will have anti-neoplastic activity. About all these drugs we'll discuss in upcoming classes. So these are important anti-cancer agents. And in yesterday's class already we have discussed about alkylating agents. In alkylating agents, we have nitrogen mustards. I think in yesterday's class we discussed about nitrogen mustards. These are very, very important. These are older drugs actually. These are older and effective drugs. Okay, and in these nitrogen mustards, Mechlorethamine, we will try to discuss about this drug now in today's class. And in yesterday's class already cyclophosphamide was discussed, and we'll also try to discuss about this Ifosfamide. These are important drugs. Nitrogen mustards in alkylating agents. Nitrogen mustards are very effective drugs, and these are older drugs. However, they are very toxic. They are used in hospitals. Okay, and Melphalan is another drug, and chloramethine. All these drugs we'll try to discuss. And we have alkyl sulfonates. All these are alkylating agents. Okay, busulfan, and in nitrosurias we have carbamazepine, lomustine, triazines. In triazines we have dacarbazine. You should try to remember all these drug names. Okay, and in ethylamines and methyl hydrogens, we'll try to discuss about these two classes in about these classes in next sessions. Okay, so these are different alkylating agents. See, in previous class already we discussed alkylating agents. What they do? Alkylating agents will go and they will bind to the nitrogen bases of the DNA. Okay, in DNA we have nitrogen bases, and on that basis these alkylating agents will go and bind. They will cause alkylating reaction. Okay, and with that what happens? The DNA replication will stop. Replication of DNA stops, and by that the neoplastic cell will not be replicated. Actually, all neoplastic cells will have very rapid replication, right? They will be having rapid proliferation. So this proliferation in the neoplastic cell will be decreased, or it will be stopped. With that, the neoplastic cell will die. So with that, alkylating agents, what they do, they are having anti-neoplastic activity. In yesterday's class already we have discussed the common mechanism of alkylating agents. In today's class also we'll try to revise. Okay, and one more point, in yesterday's class I already told that alkylating agents are the older compounds. Okay, initially these alkylating agents were initially used as chemical biowars. Okay, chemical biowar, in that these compounds were used. So there are some mustard gases. Okay, nitrogen mustard gases were used, and that gases were having immunosuppressive activity and myelosuppressive activity. With that, many people died. Okay, because of their cytotoxic activity. So, and after that, we have Louis Goodman and Alfred Gilman. These two scientists, these doctors, they studied on these nitrogen mustard moieties, and they found that these nitrogen mustards are having anti-neoplastic activity. And from then, these nitrogen mustards are very commonly used for different cancer conditions. So in yesterday's class, I think we have already discussed about cyclophosphamide, which is very, very important drug, and it is one of the a prototype, we can say prototype in the nitrogen mustards. In nitrogen mustards, cyclophosphamide is the important drugs. So let me revise some important points about cyclophosphamide. In yesterday's class, see, lifelong you have to remember about cyclophosphamide. We already know that cyclophosphamide is available in tablet form as well as in IV form, but mostly in IV form only we prefer in the hospitals. Okay, so when cyclophosphamide is infused, or when it is ingested, or when it is administered, firstly what cyclophosphamide does, it will be activated. Actually cyclophosphamide is a prodrug. Okay, it is a prodrug. this will be activated in the liver. It will be activated in the liver. So liver is the main organ which tries to activate the prodrugs into active drugs, and again the active drugs will be metabolized into inactive metabolites, and these inactive metabolites will be excreted either through urine or through feces from the GI tract, from the liver. Okay, so these points we already know. So these are basic things. When cyclophosphamide is administered to the patient, initially it will be activated, and this activated form, in this activated form, we have two compounds. One is phosphoramide. Phosphoramide, very very important. Everyone should concentrate. Phosphoramide, and second active compound is acrolein. Acrolein, acrolein. Okay, so these two are active metabolites of cyclophosphamide. This phosphoramide is having anti-neoplastic activity, cytotoxic property, and this actually cytotoxic property is nothing but it will go and alkylate with the neoplastic cells, and it will kill the neoplastic cells. Okay, so phosphoramide is the active metabolite, activated form of cyclophosphamide. This will show anti-neoplastic activity, and acrolein, it is not having any new anti-neoplastic activity. Acrolein is very very irritative, and it goes and binds on the bladder. In the bladder it causes irritation, and it causes bleeding in the bladder, and through that it causes inflammation in the bladder. And that condition, in yesterday's class already we have discussed, that condition is called hemorrhagic cystitis. Actually cystitis is nothing but inflammation of the bladder. Cystitis can be seen due to kidney stones. Okay, cystitis can be seen due to urinary tract infection, especially in the bladder infection. Cystitis can be seen in benign prostatic hyperplasia, or cystitis also can be seen in few catheters, when catheters were inserted into the bladder. Okay, so when catheters were inserted, in that injury can be seen in the bladder. With that also it can cause cystitis. Cystitis is nothing but inflammation of the bladder, and this inflammation of the bladder is seen with blood in the urine. It will cause blood in the urine, and this cystitis with blood is called hemorrhagic cystitis. So hemorrhagic cystitis is the very very important adverse drug reaction with cyclophosphamide. And this hemorrhagic cystitis is not only seen with cyclophosphamide, it is also seen with ifosfamide. Next drug, it is ifosfamide. Okay, so ifosfamide and cyclophosphamide, these both the drugs are having hemorrhagic cystitis as very important adverse drug reaction. Okay, so see, if a patient is having hemorrhagic cystitis, being a clinical pharmacist, it is very important for us to treat such patients, because patient is having ADR and we have to try to prevent this ADR. So in this case, how can we prevent? Being a clinical pharmacist, see, we have certain guidelines for cyclophosphamide treatment. When cyclophosphamide is used, when it is administered to the patient, hemorrhagic cystitis to ho hi sakta hai. It is very common. Okay, so in that cases, what we have to do, we should try to advise vigorous IV fluids to the patient. IV fluid, 2 to 3 liters of IV fluids are given when patient is taking cyclophosphamide. One important point, to prevent hemorrhagic cystitis, what we have to do, we have to suggest vigorous IV fluids. Number one. Number two, there is one very very important drug which is called mesna. Mesna is a very very important drug. Yaad rakh lo, wherever hemorrhagic cystitis comes, wherever cyclophosphamide comes, wherever ifosfamide comes, in that drug conditions, mesna is always followed. Mesna is always given in combination with cyclophosphamide and with ifosfamide, because mesna is an antioxidant. It is an antioxidant, and what it does, it neutralizes the we have what we have, acrolein, right? It neutralizes acrolein. Actually acrolein is the very very active form of metabolite which is coming from the cyclophosphamide, and it is leading to hemorrhage. It is leading to irritation to the bladder. It is irritating to the bladder. This mesna, what it does, this mesna will neutralize the acrolein. Actually it binds to the acrolein molecule, and it neutralizes the acrolein molecule, and with that the acrolein will be excreted through urine. Okay, and one more important point, this mesna I told it is antioxidant. Okay, it neutralizes acrolein molecule. And third important point, mesna is highly water soluble. It is highly water soluble. Because of its high water soluble ability, it will bind to the acrolein and it will easily remove the acrolein through urine. So, because of its high water soluble property, it will easily excrete the acrolein from the urine along with water, because always cyclophosphamide is given with excess water. Okay, so this is very important point we have to remember. Now you see, it is another very important point you have to remember. When cyclophosphamide is given, cyclophosphamide will cause water intoxication. Water intoxication. Already, when patient is taking cyclophosphamide, we have suggested to take lot of water to prevent the adverse effects due to acrolein, right? Now, here where patient is taking excess fluid, to overcome the excess water intoxication, what we have to do? We should compulsory add diuretic. We have to add one diuretic, particularly furosemide, which is a loop diuretic, along with mesna. Along with mesna, we have to add diuretic. This diuretic will potentiate the mesna and acrolein to remove from the bladder. Okay. If diuretic is not given along with mesna in cyclophosphamide, what happens? It causes water intoxication and water will not be removed from the body. Why? Why water is not removed? Because cyclophosphamide is having one very important property. What is that property? It will decrease, sorry, it will increase the production of anti-diuretic hormone. Very important point. Cyclophosphamide and ifosfamide, what they does, they will increase the production of anti-diuretic hormone. In anti-diuretic hormone, vasopressin is very best example. Actually, inappropriate release of anti-diuretic hormone will be seen. Most of the time, anti-diuretic hormone release will be increased. When this antidiuretic hormone release increases, what happens? Excretion of water is not seen, and with that, patient will have water intoxication. That's why when patient is taking cyclophosphamide or when patient is taking ifosfamide, we use excess fluid, we use mesna, and along with these two, diuretic is compulsory added. If mesna is already given and water is given, if diuretic is not given, water intoxication can be seen. Okay, so this is very important point we have to remember about cyclophosphamide and hemorrhagic. Now you see, now we discussed everything about cyclophosphamide. There is nothing left, I think. Cyclophosphamide major adverse effect you have to remember, and always remember when cyclophosphamide is given to the patient, always advise mesna, always advise diuretic, and also advise the patient to take a lot of water. If water is not given through IV infusion, we can advise the patient to take directly through oral route. Okay, these are important points you have to remember. And water intoxication can be seen. Can anyone tell me there is one hormone or there is one drug which will cause water intoxication? There is one hormone which will cause water intoxication. Anybody from the class? Hormone that causes water intoxication. There is one hormone called oxytocin. Oxytocin. Actually, this oxytocin is used to induce labor, and it is also used for postpartum hemorrhage, especially in delivery conditions. We use this oxytocin. This oxytocin will, again, it will increase the production of antidiuretic hormone. So even these also causes water intoxication. Just remember, as we are discussing about water intoxication, same action like cyclophosphamide, oxytocin also has that ability. Okay. Now you see, next very important alkylating agent what we have is chlormethine. It is also called mechlorethamine, or chlormethine, chlormethine. Okay. See, this is the simple structure of this chlormethine or mechlorethamine. I would like to tell some important points about chlormethine. Everybody should remember about this drug because this drug is very important, and this is actually it is the prototype of nitrogen mustards. In nitrogen mustards, if you study about this chlormethine, that is enough, because this chlormethine will resemble the actions of all other drugs. Okay, so the mechanism of action of chlormethine is important, its adverse effects are important, its uses and all, everything is very important. Now you see, let's try to begin the important points about chlormethine. See, one very important point, it is mainly available in IV form. It is mainly available in IV form. Okay. In few cases, it is available in tablet form also, but majorly this mechlorethamine is available only in IV form, which is used in hospital. Hospital के अंदर we will use as IV infusion, especially it is used as infusion. याद रख लो. Number two, in yesterday's class, I was explaining you the mechanism of action of mechlorethamine. Okay. Initially, what happens? Actually, mechlorethamine is a alkylating agent. First, this inactive form or prodrug of this drug, what it does, it will be activated. This active form of mechlorethamine will go and bind to the base pairs of DNA. See, this is the guanine molecule of DNA. Each DNA has guanine, cytosine, all these are base pairs. Okay. So in that, guanine is very important. On the guanine of DNA molecule, this mechlorethamine will go and bind. Actually, see, it is having two chlorine molecules on its structure, right? One chlorine will be released from one carbon atom and it will go and bind on the one seventh N of the guanine molecule. And with that, what happens? It will form alkylating compound. So it will form alkylation reaction. And remaining chlorine also tries to go and it will go and bind on the other guanine molecule of the DNA molecule. And with that, what happens? It will form cross link. It will form cross link, and further this cross link will stop the DNA replication. It will stop DNA replication, and further what it does, it will simply kill the neoplastic cell. See, hospital के अंदर these all mechanisms are not important for us, just for understanding purpose I'm telling. Okay. See, for better understanding, you can see this is the active form of mechlorethamine. Okay, the active form. It is having two chlorine molecules. When one chlorine is released from here, what happens? This carbon will go and bind to the one nitrogen of the guanine molecule. Okay, so it forms one chlorine binding here, and another chlorine atom releases, and again that will also go and bind to the another nitrogen atom of the another guanine. So two guanines of the DNA, one guanine here, it is reacted, and another guanine is reacted with the other N molecule, and with that what happens? It will form a cross link. One cross link is formed, and further this will stop the DNA replication. Okay, I think you all understood. ये molecular level में, this is just for master in pharmacology candidates and those who are working to study the structure activity relationship, and for finding the exact molecular activities. This is important for clinical pharmacists. All these are just for understanding purpose. Okay. Anyways, you see, now we understood the mechanism of action of mechlorethamine, right? Now you see, let me tell you, this mechlorethamine has certain important points. First important point is it was first clinically used in nitrogen mustard. This all already we know, and it is the most reactive compound. In this class, it is the most reactive compound, and it is the most reactive compound and the first compound used as nitrogen mustard in the cancer conditions. Everybody should listen very carefully now. Now you see, this mechlorethamine is mainly used for one condition which is called Hodgkin's lymphoma. There is one cancer condition called Hodgkin's lymphoma. I will try to explain about Hodgkin's lymphoma in specific cancer conditions. Just as we are discussing about mechlorethamine, just remember, mechlorethamine, this drug is very, very effective for Hodgkin's lymphoma. You know what is Hodgkin's lymphoma is? It is a cancer of lymphatic system. We have lymph vessels, and we have blood vessels, and in lymph vessels we have lymph nodes. Lymph vessels will be transporting the fluid. Along with that, it will be transporting the lymph cells. Okay, all immune related cells. We have so many cells. Okay. Anyways, you see, this Hodgkin's lymphoma is the cancer of lymphatic system, where patient will have swollen lymph nodes. Swollen lymph nodes. Lymph node, if we see the patient in this neck region, we have a lot of lymph nodes, and in the groin region, in the neck region, and in the groin region, we have a lot of lymph nodes. All these lymph nodes will be inflamed. Easily we can see the swollen neck and the swollen groins. So Hodgkin's lymphoma, it is the cancer of lymphatic system, where we can see swollen lymph nodes. And this Hodgkin's lymphoma, एक चीज याद रख लो everybody, it is mainly characterized by, there is a specialized cell called RS cells. If anybody has RS cells in their body, they are diagnosed with Hodgkin's lymphoma. So Hodgkin's lymphoma is the condition where it is mainly characterized by RS cells. You know what is RS cell? RS cells are called Reed Steinberg cells. Actually, it is the scientist name. Okay, Reed Steinberg cells. These RS cells are called Reed Steinberg cells, and these RS cells are mainly caused, especially in the patient who is having infection with Epstein-Barr virus. In previous class, I discussed there are certain biological agents, there are certain virus particles, there are bacterial particles, biological agents which can cause cancer. In that, Epstein-Barr virus is one very, very special virus which will induce formation of RS cells, and RS cells are main characteristic feature of Hodgkin's lymphoma. If anybody has Hodgkin's lymphoma, Mechlorethamine is the very, very commonly effective drug which is used in Hodgkin's lymphoma. I think this point is clear to you all. Along with Hodgkin's lymphoma, there is one more cancer which is very similar to actually it is a type of Hodgkin's lymphoma which is called CTCL lymphoma or CTCL cancer. Okay, cutaneous CTCL means cutaneous T cell lymphoma, cutaneous T cell lymphoma. Okay, so cutaneous T cell lymphoma is the type of Hodgkin's lymphoma actually. So in this lymphoma also, meclorethamine is used. Remember, in Hodgkin's lymphoma, CTCL lymphoma, meclorethamine is commonly used drug, and you already understood what is RSL. RSL is the main characteristic feature of Hodgkin's lymphoma. Whenever Hodgkin's lymphoma comes in mind, you have to remember about RSL, and you have to remember about Epstein-Barr virus, and you have to remember about meclorethamine. Clear? I think this point is clear to you all. So this is the first important point. It is the first reactive agent which is used for Hodgkin's lymphoma. Now you see, yes, I already told it is topically. Actually, for topical purpose, we have certain formulations which is used for CTCL. CTCL is, what is CTCL? It is a cutaneous T cell lymphoma. It is a type of Hodgkin's lymphoma. Okay. Now, another very important point. Nowadays, actually, this meclorethamine is replaced by cyclophosphamide, Melphalan, and more other alkylating agents. Meclorethamine is not very common. It is not used nowadays. Wherever meclorethamine was used, in that conditions, the safer drugs and low toxic drug like cyclophosphamide or Melphalan or Ifosfamide are suggested, because meclorethamine is the older drug. It is the oldest and it is the prototype. It is the first drug in nitrogen muscle. Okay, nowadays, instead of meclorethamine, we are using cyclophosphamide and other drugs. That you have to remember. And one more very, very important point, as I already told you, it is very highly irritant. And see, meclorethamine is the component of MOPP. Everybody should concentrate here. There is one very, very famous drug regimen, treatment regimen, which is called MOPP regimen. There is one regimen called MOPP regimen. In Hodgkin's lymphoma and in some other specific cancer conditions, I'll try to explain this treatment strategy. There is one strategy which is very important strategy and very famous actually. It is very famous strategy which is called MOPP regimen. In this regimen, we have 4 drugs. This each letter determines one drug. In this, M indicates meclorethamine. Meclorethamine. M indicates meclorethamine and O indicates oncovin. You know what is oncovin? Oncovin is the brand name actually. It is the brand name of vincristin. Vincristin and vinblastine are the alkaloids actually. These are natural occurring anti-neoplastic drugs. Naturally occurring alkaloids. These are very, very important. I'll try to explain about these also. So vincristin ka different other name is oncovin. Actually, oncovin is the very, very important standard brand name it is. So in this regimen, in MOPP, M indicates meclorethamine, O indicates oncovin, which is a vincristin, and P indicates prednisolone. Prednisolone is the corticosteroid. Everybody should try to understand about corticosteroids. Already in few previous classes, I explained about these corticosteroids in detail. If you're interested, you can just find. I'll try to add the link in the description. You try to learn about this corticosteroids. Very, very important drugs. Being a clinical pharmacist, you should try to learn about corticosteroids. Prednisone, betamethasone, dexamethasone, okay, hydrocortisone. All those are different corticosteroids. And here P indicates prednisolone, and next P indicates procarbazine. Procarbazine. So these are 4 drugs. M indicates meclorethamine, O oncovin, which is a vincristin, P indicates prednisolone, and one more P indicates procarbazine. So this procarbazine is very similar to alkylating agent only. It will have same mechanism like alkylating agent. And these four drugs, actually, this four drug regimen, again, this four drug regimen is very effective for different types of Hodgkin's lymphoma. Actually, in Hodgkin's lymphoma, MOPP is very famous treatment regimen. So in MOPP, mechlorethamine is one of the component. Okay, I think you all are following me, right? And about mechlorethamine, yeah, I think we have discussed most of the points about mechlorethamine. Remember, mechlorethamine, it is the important agent, reactive agent, and irritant agent, which is used for Hodgkin's lymphoma, and it is one of the component of MOPP. Okay, so this is about mechlorethamine, and sometimes it is very effective for CTCL cancer also, cutaneous T cell lymphoma. Okay, now let us discuss about ifosfamide, another very important nitrogen mustard, which is the again alkylating agent. Ifosfamide is very similar to cyclophosphamide. Ifosfamide, cyclophosphamide. Name may it is very similar. See, so ifosfamide is very similar to cyclophosphamide. This is the structure of ifosfamide. Actually, it is having two different what we can say isoforms. Okay, see, this ifosfamide has certain very important parameters. I mean, important characters. I will try to explain those characters. Ifosfamide के बारे में. One thing you should not forget that it is very similar to cyclophosphamide. Okay, and now you see. Let me rub this. Okay. Yes. Yeah. So ifosfamide is very similar to cyclophosphamide, and it is the analog of cyclophosphamide. Okay. And see, in previous class, just now I explained you about the adverse drug reactions of cyclophosphamide. In that, the specific adverse drug reaction is hemorrhagic cystitis. Okay. So along with cyclophosphamide, ifosfamide also has same adverse effects. Along with that, it will not only cause hemorrhagic cystitis like severe urinary tract related adverse effects, it will cause CNS adverse effects also. In CNS adverse effects, you have to remember it will cause neuropathy, it will cause peripheral neuritis, and with this neurotoxic ability, it can cause hallucinations. So in CNS system, actually in CNS system, ifosfamide can cause mental disorder also. It can cause hallucination in the patient. Schizophrenic symptoms can be seen due to ifosfamide. This is very important. And see, when ifosfamide is used, already we have discussed, we have to hydrate the patient, and we should also administer mesna to reduce the adverse effects of hemorrhagic cystitis. Okay, and along with that, see, when patient is having bladder toxicity, we can go with IV infusion, we can go with other mesna, and we can try to neutralize the condition. But if patient has CNS toxicity, we have to treat the patient with methylene blue. I think you know about methylene blue. Methylene blue is very actually it is the not commonly used compound. It is a salt actually. It is a simple salt which is used in inorganic and organic chemistry for identifying purpose. It is a dye actually. It is a dye. It is a salt form of dye, and it is used to identify the compound. That's it. And this dye also has some clinical uses. I will try to tell you some important clinical uses of this methylene blue. एक बार अगर सीख लो जिंदगी भर याद रख लेना. Everybody should try to remember about this methylene blue. See, methylene blue, it is a dye. We already know it is a dye, right? This methylene blue is having certain uses in the hospital. It is mainly used in cyanide poisoning. In cyanide poisoning, this methylene blue is used. Do you know this point? Methylene blue can be used in cyanide poisoning. It is mainly used in certain conditions where patient has methemoglobinemia. Methemoglobinemia, where patients oxygen, I mean the ferrous form of oxygen, ferrous atom is converted into toxic form, very dangerous form and very complicated form. Methylene in condition where hemoglobin is converted into methemoglobin, which is called methemoglobinemia. Methemoglobinemia is the dangerous condition. In that condition also we can go with methylene blue. Actually, this methemoglobinemia is one of the toxic condition which is seen due to carbon dioxide poisoning or in some septic condition also, sepsis, in toxic conditions, and in a few drug poisoning conditions. In that conditions, methemoglobinemia can be seen. In that condition, methemoglobin is used. It will improve the oxygen concentration and hemoglobin concentration, and with that, it will save the patient in emergency condition. Anyways, about this methemoglobinemia and about this condition, we'll discuss later. So it is used in cyanide poisoning. It is used in methemoglobinemia, and sometimes methylene blue actually it is used to study for. It is used to check the milk purity. Okay, in checking the milk purity also it is used. Actually, what happens, in certain conditions, the methylene blue few drops were added into the milk, and with that, when few drops were added, immediately the original milk is totally converted into blue color. If it is not converted into blue color, we can say that it is faulty milk or it is impure milk. Okay, so through that we can use methylene blue dye in identifying the purity of the milk. Okay, and it is also sometimes used in septic shock conditions. Methylene blue is also used in certain septic shock conditions, and along with that, it also has some other important uses. We'll discuss about this methylene blue in some other lecture. This is some basic things about methylene blue you have to remember. Okay. So if patient is having toxicity due to ifosfamide, especially for the CNS toxicity, in ifosfamide poisoning condition or in ifosfamide CNS toxicity conditions, methylene blue is commonly used. Okay. And one more point you have to remember: methylene blue can cause hypertension. Very important point. Methylene blue can cause hypertension. So in hypertensive cases, methylene blue should be keenly monitored and it is observed. That's why due to its hypertensive activity, it can be used in few septic shock conditions, anaphylactic shock conditions, in hypotension, and in methemoglobinemia due to methemoglobinemia and hypertension. If it is existed, in that cases, methylene blue should be the drug of choice. I think you all are following me. So these are important points about methylene blue. And other important points about ifosfamide is it is used in testicular cancer and in sarcomas. In sarcomas and in testicular cancer, this ifosfamide is very commonly used. Now let me try to add the important points and adverse drug reactions of ifosfamide. See, before that, I already told you ifosfamide is having same structure like cyclophosphamide. See, these both are very similar. Okay. If you see the adverse effects of ifosfamide, the adverse effects are almost same like cyclophosphamide, but this ifosfamide may cause CNS ADRs, and along with these CNS ADRs, it can cause hallucinations, and along with hallucinations, it can cause coma also. It can cause coma, and patient may cause mental disorders. Coma is, if patient is having coma, then it is after coma patient will die. Okay, so this ifosfamide special adverse effect is on central nervous system, and for cyclophosphamide in yesterday's class already we have discussed the general toxicities, and specific toxicity is hemorrhagic cystitis. And see, along with this, ifosfamide has thrombocytopenia. Thrombocytopenia, very important. Definitely, when patient is taking ifosfamide, it will cause thrombocytopenia. When patient has thrombocytopenia, again it will cause bleeding risk. It will cause bleeding disorder. So if anybody has thrombocytopenia, when patient is taking ifosfamide, we have to advise the patient with infusion of platelets. Okay, platelet infusion should be done if patient has thrombocytopenia. Okay, and another very important adverse effects of ifosfamide is it causes nephrotoxicity. Nephrotoxicity and neurotoxicity already we have already discussed. So this nephrotoxicity, thrombocytopenia, and CNS adverse effects are the particular adverse effects which are seen with ifosfamide, along with the other adverse effects which is seen with cyclophosphamide. Okay, so these are important adverse effects you should not forget about ifosfamide. Now you see, for ifosfamide we have certain guidelines. This is very important for clinical pharmacists. This is important. Ifosfamide is available in IV form. This one you have to remember. Okay, ifosfamide when it is infused, if it is infused in the hospital, always remember the standard dose. Standard dose is 1.2 grams of ifosfamide is calculated for meter square per day. 1.2 gram per meter square per day. It is the standard dose for ifosfamide. So what is the normal? If you see, if for an adult patient, what is the normal body surface area for adult? Approximately for adult. Yes, yes, 1.72 or 1.73 square. So this is the normal, this is approximate value, okay? 1.73 meter square is the surface area of the adult. And for pediatric patients, it is different, okay? See, this is the standard dose. 1.2 gram per meter square per day will be the standard dose. And you can calculate, depend on the patient's body surface area. And with that, you can calculate the dose per day. And this dose is given for 5 days. Actually, this ifosfamide treatment, ifosfamide regimen, 1.2 gram per meter square per day is calculated, and this is given for 5 days, once in a day. This dose is given once in a day. This dose should be given once in a day, and it is continued for 5 days. Now you see, this normal dose we have already understood. We have seen that ifosfamide can cause neurotoxicity, nephrotoxicity, and it can cause bladder toxicity. Okay, same like cyclophosphamide. So here it is having this risk. So what we have to do along with ifosfamide, always remember we have to add mesna. We have to add mesna. How much mesna should we add for 1.2 gram meter square per day? We have to add, or we have to infuse. Actually, we have to go with bolus dose of mesna. Here, this ifosfamide 1.2 gram per meter square per day is given over 30 minutes. This infusion, this dose is infused for 30 minutes. 30 minutes that we have to infuse. Whereas mesna is to be given directly without infusion. It can be given bolus. And here the bolus dose of mesna should be 20% of the normal dose of ifosfamide. For example, if we take 2 gram as, if we calculate the dose, 2 gram of ifosfamide is given as standard dose per day. For 2 grams, what is the 20% of mesna? For 1 gram, 20% is 200 mg, right? And for 2 grams, it is 400 mg. So 400 mg for every 2 grams. This is just a rough estimation I'm taking. You can calculate this dose for specific body weight and specific their according to their body surface area. Okay, so for this dose, 20% of mesna should be added for the patient, and this 20% of mesna should be given for every 4 hours, and this should be given 3 times. 20% of mesna should be given for 3 times, and we have to make it 60% of mesna of actual dose of ifosfamide. Let me repeat. Ifosfamide, for ifosfamide can be given only once a day, and that is ingested, that is infused over 30 minutes because it is irritant. For 30 minutes we have to infuse. Once it is infused, immediately mesna should be given. 20% mesna should be given once, and for every 4 hours it is given 3 times, and we have to make it 60%. 60%, up to 60% of mesna should be given for cyclophosphamide and also for ifosfamide. This is the standard treatment guideline for this ifosfamide. And now you see, in previously we have already discussed, mesna should be given along with water also, right? We have to go with water. So how much water should we go? Approximately 2 liters of water should be given either through oral route or through IV route. So these 2 liters of water should be always calculated if mesna is infused with water, or if this water is infused with standard infusion of ifosfamide. See, most of the cases ifosfamide is infused with normal saline or with water, or directly it is infused. In that cases, we have to calculate the same water. So approximately 2 liters of water should be given per day. Per day, 2 liters of water should be given either through oral route or through IV route when uh, ifosfamide infusion is given, and when mesna is given. Mesna will try to decrease the bladder toxicity, and water will try to excrete the metabolites of mesna, and it will try to decrease the cytotoxic property of this drug in normal cells. Okay, I think you understood about this treatment guideline. Are you all following me? Now, Peragalas, we'll continue. We will continue in the next class, ma. Okay.